How you doing, Mr. Jones? My name is Josh. I'm going to be taking care of you today. I saw that you had some orders in for suction if you need it. Do you need it right now? Is now a good time? He's going to tell me yes. I'm going to provide for privacy, gather my supplies, do hand hygiene, verify my patient, which I've already done. Now at this point, we can put on a pair of exam gloves and do a respiratory assessment. Raise it up a little bit. Alright, so we're going to listen to all the lung fields underneath the gown. We're going to put on exam gloves. And this is just going to give us a baseline for what he sounds like before we do anything. We're going to find our suctioning and make sure when we suction that it's between 80 and 120. So that's about where we are right now. We're going to put a pulse ox on him. And we can put his oxygen on blow by, so he's still getting some. At this point, we can take our saline, cap it, or lip it. We can open our thing. We've already lipped it, so we can pour some in there. Set this over there, and now we can put our sterile ones on. Okay, so we've got our sterile gloves on, and at this point, we grab our suction with our hand we don't want to be sterile, and we attach our little suction piece with our sterile hand. Make sure it's not touching any part of the actual suction tube. So we're going to make sure it works. It does. We can put it in there, and now we can go into the trach. Ask the patient to take a deep breath. Ask the patient to cough for us, and when we come out, we're going to do a intermittent suction with a little twisty motion.
So both my gloves are on really silly.
So now we can reoxygenate him. Ask him to take some more deep breaths, and then we're going to do another focused respiratory assessment.
Fresh.
Under the gown, of course, and we're just going to see if his condition has changed any from baseline. So after we're done with that, going to make sure it still works. Go ahead and rinse those secretions off, and we can go back in. Going to reoxygenate, ask him to take some deep breaths, and then we're going to do another focused assessment. Under the gown. Okay. And now at this point, we're going to rinse our thing off again, make sure it still suctions, and we can go back in for a third and final pass if he wants us to. Reoxygenate. We can keep his oxygen on now. We're going to do another focused assessment. Now we can take our piece off. And we're going to document color, odor, consistency, amount of secretions, how the patient tolerated. We're going to finish by putting the bed in the lowest position. We're going to discard all of our items here, do hand hygiene, and then we're going to be good.